Now, the best thing you can do in order to be safe is take into account some of these things. You can sing happy birthday while you're washing hands for 20 seconds. So it has to be a good 20 seconds, sort of like how um, surgical surgeons do it, or anyone working in the surgical ward does it. It has to be really well done for 20 seconds. You can just use regular soap and water. You don't have to use alcohol based hand sanitizer. Or you can use alcohol hand gel with 65% alcohol. This can be made at home with aloe vera and alcohol. You can make it at home. So if stores have run out of these, you can go ahead and make your own. Try not to touch your face. Cover your sneeze with your elbow, not with your fingers. Throw away tissues and anything that has bodily fluids on it. If you have fever and cough, stay home. It could be anything. It could be flu or it could be coronavirus. So you don't know that. You don't know which one it is. Because the a virus infects your immune cells during the initial stages of the infection, you will have leukopenia and lymphocytopenia, which basically means you have really low blood cell count. So your immune system is completely down during the first um, phase of infection. And that's why you start seeing cough, your immune system is down, so you will start seeing symptoms. And this has happened to 63% of patients. But eventually, it kind of picks up. You will start having leukocytopenia. In fact, or you will start having the opposite. You will have um, increased white blood cells and increased lymphocyte counts. So this is the early stage, and it's going to be go to the opposite direction in later stages. Mask only will work for people who are sick. So if you have coronavirus, you trying to cough into the mask would help people around you because you're not going to cough long distances. It's not going to spread throughout the room if you cough or sneeze. So it doesn't do any favors for you, but it's for protecting other people if you are sick. N95 only works if it has a good seal, and because of supply demand and people ordering it in bulk, you're going to have a hard time finding these masks even online, or it will be really expensive to get these. And it only works if it has a good seal around your mouth. So people with beard, people with um, facial hair, it will have a hard time. It's probably not going to be as effective because it will be just as much as using these paper masks. For the rest of us, keep your immunity high. Try to stay outside crowded places. Try not to go to crowded places. Keep your immunity high by taking your nutrition, washing your meat, like cooking your meat, washing it properly, handling meat well, or taking vitamins and taking care of yourself. That's the best way to keep up your immunity. Sleep has shown a significant effect on keeping up immunity. Your immunity goes down when your is sleep is less. You get less sleep. And for people who has diarrheal illnesses or people who have some sort of GI symptoms, so initially in China they found that people who has diarrhea was probably not of concern. But then later on, they found that they were just as infective as people who showed respiratory symptoms. So if you have loose stools, you are infectious. So try to stay out of public place where other people who are prone to get it will be avoided. So that's the best way you can protect the public from transmitting whatever you have. It may be due to some GI bug, but still it would be in the best interest of everyone to not be in public place while you have some GI illness. Things you can stock up on is alcohol hand gels, like we talked about, just regular hand soap, cleaning supplies. You don't have to have bleach, like we talked about. Mm. So have some medications if you have cold or flu. There's no way of knowing. So get your allergy medication, get some Tylenol for fever. Remember, we said fever is the first thing that shows up. So get some Tylenol for the fever. Get food, clean all the common places like the switches, um, doorknobs, stuff like that. Face mask is only helpful for people who are sick, And antibiotics does not work because this is a viral infection. So even I just want to put that misconception to rest. So when you go to the hospital, you'll notice that they have set into place airborne prevention, droplet prevention, and contact and standard prevention. This is what worldwide we are adopting by creating social distancing, by making people not come to public places or crowded places, canceling out events, canceling sport events, entertainment. That is how you're preventing contact. And so let's discuss these airborne way of transferring and droplet transfer. So airborne transfer is, let's say there are two people in a closed box. Let's say you're in the flight. In flight, because the air is being circulated, people sitting in one end of the flight can be infected by someone on the other end. That's what airborne or aerosol precaution means. Like it can travel far distances, and if one person is infected, the whole room is at risk of trans getting that illness. So that's why in certain hospitals, because they don't have the N95 mask for everyone, um, it's best to quarantine people and take care of the issue in a negative airflow room. It's sort of like how TB is treated, then trying to just treat it as a droplet prevention method. So, in droplet prevention, when someone sneezes, the moisture that's in our lungs forces out the water droplets. So, when you sneeze or cough, all the heavier droplets will fall within the first few feet, and then the rest spreads out and diffuses. So, only the person standing right in front of you is at risk of getting that straight in their face or getting it straight in their eyes, nose, mouth. So it doesn't travel far distance. So if you're in a room with someone who sneezes in other end of the room, you're not at risk like someone who is who is being treated with an airborne infection. So droplet prevention is just for people who sneeze and cough, and that's why they say use the face mask. But this illness, we some say that it is a droplet precaution is just enough, and some say that airborne precaution is needed, or like uh, if one person in the room is infected, then everyone can be infected if they breathe that same air. Then, by closing down places or wearing protective gears, like you see, the whole hazmat suit and social distancing works for trying to prevent. And that's how the hospitals and the government is trying to deal with this. What can you do? If you have recent travel, you're at most high risk because you don't know who you came in contact with. You have been in a public setting where, and probably you are an asymptomatic carrier. So the best thing you can do in order to protect the elderly who is likely to contract this illness is by staying home. So that's what we talked about, social distancing. There is no vaccine in sight yet. There is protease inhibitor that is being tested out. This is the HIV medication that they give, but it's also expensive. So I don't think there is going to be a vaccine coming out anytime soon. And don't go to your doctor and just sit in the waiting room if you are infected or you have some sort of cold and flu symptoms. Just don't go and sit in a doctor's office. Maybe call ahead of time, or let somebody know, because you're putting everyone in that room at risk if you are possibly ill. And now it is a pandemic. It's been declared as a national emergency as of March 2020. So the only way we can protect the elderly and people who are at risk is by not being out in the open, by social distancing. That's the best you can do for them.